So this is the shoulder introduction. It's also important to remind you to check on surface anatomy about the shoulder, both for the scapula and the glenohumeral joint. There's two main issues that we're going to be addressing with shoulder intervention. The first has to do with instability of the glenohumeral joint. The other one is the acromioclavicular joint, or the AC joint. So when we're talking about the glenohumeral joint instabilities, those could be injuries related to subluxations or dislocations. Rarely are we going to utilize a compression wrap for someone who is chronically dislocating. These are going to be either someone that we're going to wrap because their shoulder is slightly unstable, or we're utilizing that wrap underneath a brace that's providing more stability for that person's shoulder. So we really want, with someone with a glenohumeral injury, to utilize that compression wrap that you will see in the video to prevent that patient from going into an abducted and externally rotated position, which is going to replicate typically the mechanism of that injury. That's going to cause that glenohumeral joint to move anteriorly out of that joint. Now, when you're putting that wrap on, again, when you're watching the video, make sure you're really looking at patient position and the pull and direction of the wrap. You're going to have that person into an internally rotated position and slightly adducted, so that that wrap is preventing that person from getting into that position you don't want them to get into. The other intervention we're going to be seeing is AC joint sprains. So that typical shoulder sprain on the top of their shoulder, they're having a lot of pain. The intervention we're going to be showing you in the video for AC joint injuries is really trying to prevent pain when they're going through the just everyday life. So what you're going to see is you're going to have to identify where that AC joint is specifically, which is really important to know your anatomy. You're going to look and find that joint, and we're going to be taping that joint down so that that clavicle doesn't move up and down when you're walking. So that intervention, it's important to know, the intervention is going to be slightly painful. As you push down with that tape, it's going to cause a little bit of discomfort, but it's really going to cause less discomfort as they walk around throughout the day, because that tape is holding that joint from moving up and down. So it's really, really important to look at patient position and understand what the function or purpose of these different tape jobs are. So when you watch those videos in the media gallery, that will really help you.